Look closely at this microscopic view. What you are seeing is cells rapidly dividing, multiplying into a dense, chaotic cluster. During adolescence, the human body goes into overdrive, constructing bone and muscle tissue at incredible speeds. But sometimes that frantic biological construction makes a critical error. Osteosarcoma is a type of bone cancer that initially mimics regular, healthy bone cells, hiding in plain sight before forming malignant tumors. As this skeletal diagram shows, the cancer specifically targets the body's long, weight-bearing bones. It primarily strikes teenagers and young adults under 25, settling into the femur in the thigh, the tibia in the shin, and the humerus in the upper arm. These tumors aggressively take root right at the major junctions, specifically around the knees, hips, or shoulders, compromising the structural integrity of the limbs. The tragic irony of osteosarcoma is that the biological prime of a teenager's rapid growth phase, the very mechanism making them taller and stronger, is exactly what makes their skeletal system vulnerable to the disease. Because it strikes highly active age groups, early warning signs are easy to misinterpret. Joint stiffness, persistent swelling, or sudden bone fractures are frequently dismissed by patients and parents as ordinary sports injuries. This false sense of security is compounded by the disease's inconsistency. While some tumors cause a deep, noticeable ache, others grow entirely without pain, depending on their location and speed of expansion. Missing these subtle signals carries a severe consequence. By the time a proper diagnosis is finally made, nearly 20% of osteosarcoma cases have already metastasized, meaning the cancer cells have spread beyond the original bone. This chart illustrates exactly why early detection is critical. The survival rate stands at about 70% when the cancer remains localized, but sharply drops to around 50% if the disease has metastasized. Mistaking these symptoms for standard growing pains allows the cancer the time it needs to spread, pulling a patient's survival probability down from a 70% majority to a 50% toss-up. To confirm the cancer's presence, doctors escalate their imaging techniques. They start with basic X-rays to spot obvious bone damage, then deploy advanced MRI and CT scans to map the exact size and depth of the tissue invasion. Once the primary tumor is found, the medical team conducts a process called staging. Using specialized PET or bone scans, they examine the entire body to definitively check if the cancer cells have migrated to the lungs or other bones. At the root of this cellular chaos are deep genetic triggers. Look at this animated DNA helix. Researchers have linked osteosarcoma to the p53 mutation, an internal misfire where a specific DNA segment breaks down, stripping away the body's natural tumor-suppressing defenses. Diagnosing this disease requires physicians to map a complete systemic failure, tracing the biological threat all the way from macroscopic bone fractures down to microscopic genetic errors. To determine their counterattack, oncologists categorize the cancer into low, intermediate, or high grades. This calculation dictates the required speed and aggression of the treatment, with high-grade tumors demanding rapid, intense intervention. The first phase is chemical warfare. Systemic chemotherapy is deployed throughout the patient's bloodstream to attack the malignant cells and shrink the primary tumor before physical extraction begins. Next comes the surgical phase. Whenever possible, surgeons perform limb-salvage procedures, carefully removing the infected segment of bone and replacing it entirely with artificial metal implants or bone grafts. In severe cases where a knee cannot be saved, surgeons utilize the radical biomechanics of a procedure called rotationplasty. As this schematic demonstrates, the diseased knee is removed and the healthy lower leg is rotated 180 degrees, then reattached so the ankle can function as a brand new knee joint. Eradicating high-grade osteosarcoma leaves no room for half measures. It forces medical teams to rely on an extreme, calculated combination of toxic chemistry and radical biomechanical reconstruction. Enduring the initial surgical and chemical interventions is a monumental victory, but for these young patients, it is only the beginning of a lifelong medical ordeal. The aggressive treatments extract a severe psychological and neurological toll. Patients frequently battle intense mood swings, memory degradation, and the devastating reality of permanent infertility caused by the heavy chemotherapy. The collateral damage extends to the body's internal systems. The very chemicals used to kill the cancer leave vital organs, including the heart, lungs, ears, and kidneys, permanently compromised. The cure for osteosarcoma exacts a massive physiological cost. It forces patients to trade an immediate lethal threat for a lifetime of chronic biological vulnerabilities. To manage these lasting effects and watch for any signs of recurrence, patients must commit to a relentless schedule of medical surveillance. Scans are required every 3 to 6 months initially, eventually transitioning to strict annual checkups. Alongside the physical monitoring, prioritizing emotional support and mental health care is an absolute necessity to help these individuals process the immense trauma of their diagnosis and treatment. Taking control of this journey starts in the doctor's office. Every patient and family must demand clear answers to a specific checklist of questions. What is the tumor's grade? Has metastasis occurred? What are the exact surgical options, and what side effects should we expect? Surviving osteosarcoma requires these young patients to trade the carefree nature of youth for the discipline of a medical professional. They must become the lifelong lead managers of their own health, constantly tracking a complex web of cardiac, renal, and skeletal risks.